Hello, and welcome to this episode of the Authentic Physician Show, where we have conversations that are real about medicine, identity, and health transitions that women maybe aren't prepared for. I'm your host, Dr. Amy Loden Tiffany, and we have a special guest today with us, Dr. Charlotte Grinberg, who is going to help us understand a little bit more about what it means to try to juggle work, take care of yourself, and figure out what your body is doing when it's not doing what you thought it was going to do, and you're doing all the things you've always done. So today's conversation is going to be fun. I'm going to let Dr. Grinberg go ahead and introduce herself to you and highlight some things that I think she wants you to know, and then we're going to jump in with some questions.
Amazing. Thanks so much, Amy, for having me.
Yes.
I live in the DC area. I have 5 little kids under the age of 9. My first was born like at the very start of residency. So that's how many years I know I've been a doctor. Um, I am an internal medicine doctor. I did a fellowship in hospice and palliative medicine, and then I specialized in hospice for a few years. Recently, I continued to do hospice care, but I also started a micro practice as a DPC or direct primary care provider. So I do both primary care and hospice work. And then I also write. I've written all about experiences with birth, pregnancy, death, primary care over the last decade as I sort of go through the healthcare training and practicing experience.
So you've got your mom hat, your physician hat, your author hat, your creative hat. You're very busy.
Yeah.
Yes. If I took away the credentials from training and education, which, from what I understand, tell me if I'm wrong, you're Harvard trained, right? Like best of the brightest here. And there's a whole amount of credentialing that goes with that. So we're going to put all that aside. What I want to know is who are you without that? You talked about being a mom. You talked about being an author, which I'm not sure if that falls more on the mom side or the physician side, but who are you without those credentials?
Um, I think my greatest role in life is being a wife, actually.
Mm,
I have been with my husband since we were 17 and 18. So I feel like I've gone through all of adulthood with him, and it's just been the best. I always tell him I love him more each and every day.
love that.
And that love is like infinite, it feels. So it keeps
Hmm.
growing. And so it's just really cool to have someone that I've been able to go through all of adult life with and build a family with and inspire each other professionally. But I just always feel like life just, I say all good roads lead to from him and to him.
It's beautiful.
um, and yeah, I wish we sort of really prioritize like partnership,
Mm,
um, romantic love, because I think it really adds to people's happiness and even their longevity. Like I always say, like
mhm.
one of the best things that we're doing for each other is health, is being together and loving each other. And so, yeah, I would say that's the biggest part of my identity.
That is very cool. So I actually invite you to say a little bit more about that because not everyone wants a partner, has a partner. Maybe they're getting out of a bad relationship. How tie that in for us again? How do you connect that with longevity? And is singlehood a negative thing toward longevity?
Yeah, I mean, I think there's like the data that shows that being in a sort of just in general, like having social relationships, being in community, is really good predictor of health and wellness, and that being long term. And I think marriage is part of that. And I think like so it's yeah, it's always hard to like talk about a really amazing thing, but then also caveat that it's not for some people or it doesn't work out
Right.
for some people. I feel that way about breastfeeding, for example.
Yes.
Like it's like
Yes.
you want to just like talk about all the amazing parts of like breast milk, but then there are some women who just like cannot
Right.
breastfeed and it's not their fault and they didn't do anything wrong. And so how do you talk about a good thing without making people feel guilty? So but it is like what the data shows is that it's a really
Yeah.
good thing. And then yeah, my just like personal experience has been um, really lovely. And like, it's really interesting because we're in a sort of a unique living situation where my childhood best friend is married to my husband's childhood best friend,
Hmm.
and we live right next door to each other. So we
How fun.
moved just specifically for that reason. And so it's really lovely to see their marriage and how thriving and wonderful their marriage is. And I feel like we learn from each other constantly because we're always in each other's like personal space and
Hmm.
situation. But I think it's helped us have the best versions of our marriages and of our friendships and of our community. And so I also think having wonderful neighbors and those kinds of friends is also a really good proxy for taking
Hmm.
good care of yourself and
Yeah.
valuing your health.
Yeah, and you've basically created intentionally that type of situation, it sounds like.
Yeah, it happened after so I was a hospice doctor and I saw basically like 1,000 people die, in a year.
Yeah.
And yeah, it was just really hard and intense. And in seeing that, you just see that what matters most to people at the end of their life is
Mhm.
their relationships and their children and their friendships and their community. And you never hear about
Right.
people's jobs. And
Mhm.
so I was like, we did this like math calculation where like we were only seeing each other once a year because it's really hard to travel with little kids. And
Yes,
so we're like,
yes.
we're only going to see each other like 70 more times in our lifetime. And that's so sad, and so
Right.
they're the most important people in our life to us, and so,
Mhm.
yeah, we moved and now we see each other, like, 70 days, like, in less than a quarter of a year, so
I love that. That's just the intentionality and the thoughtfulness of it and the design that you all had to do and maybe buck the trend a little bit to do. I wanna pick up on something you talked about, 1,000 people you saw die in a year, and you and I both know these are not necessarily all people at the end of their life. Some of them were young or in midlife, and to your point, it's not the job that's holding their hand. Um, when you think about the women, specifically the women that you've seen die well, what was it that they did differently?
Yeah, thanks for acknowledging, like, it's not just old people because I feel like that's
Mhm.
a super common misconception, like, people are
Yeah,
always like, "Oh, you do hospice, like, it must be so meaningful to help elderly people in their final moments in life," and I'm
right.
like, "It's not." Yeah, it's
Yeah,
like
there's so many
yeah, it's
others.
so many young people and a lot of people with young kids and
Mhm,
families and,
mhm.
or sudden illnesses, so there's, I think, a lot of sort of tragedy that most people don't wanna confront or think about or even know
Right,
about,
right.
but I think you can see, like, even people in really tragic circumstances die well, and I really
Mhm,
think it just comes down to people speaking really openly and comfortably about death and dying and mortality over a
mhm,
long period of time. Like, it's
mhm.
like you can just tell when families or the patients themselves, like,
Yeah.
they have a world view or philosophy around mortality,
Mhm.
and they are comfortable, like, talking about it.
Okay.
Like, they can share, like, "This is what I want at the end of my life," or "This is who I want to be there," or "This is what's
Mhm.
important to me," and even to just, like, have conversations about it is so many people can't do that,
Right.
and so for the people who are able to do it, and then their family and their loved ones, like, lean into it and
Mhm.
continue to have those conversations, like, there is a sense of calm and acknowledgement and acceptance, which
Mhm.
allows, like, for the deep sort of emotional and spiritual connecting and work to be done.
Well, it's interesting you said that because I was wondering as you were talking, do the conversations seem to be more natural or not if someone has a faith perspective or not?
For sure, yeah, I would say
Okay.
100%, like, I became a more, like, religious person and,
Mhm.
like, God-believing person, like,
Mhm.
doing end-of-life care because
Yeah.
I was like, "This helps people so much." I was
Right.
like, "Wow," like, people are so, like, they have so much wisdom and
Mhm.
perspective and calm and purpose. And I was like, this just seems like a very helpful way of life and
Mhm.
perspective to have because it helps you not just through the day to day, but also the really joyous moments and also the really devastating moments. So, yeah,
Right.
I would say in general, like the people who are most calm, like have a faith that they believe in, and then they
Mm.
have the community support of their faith, or a particular faith leader, and just believing in like a world to come or that there's something greater beyond ourselves. I think gives people a lot of comfort and purpose. And
Mhm.
so I feel like medicine was like my medical training was like completely devoid of anything around
Same.
religion, like
Mhm.
0%. Like I
Right.
had no idea what the faith backgrounds of my peers were or like my
Yes.
teachers or on rounding, like it just
Mhm.
never came up. But the cool thing about hospice is like we have like a chaplain
Mhm.
on our team, and like every single week in our weekly meeting, she starts with like a sermon. So we like hear about God and like talk about God. And so it's very much like part of the
Interesting.
professional work, if that makes
Mhm.
sense.
Mhm.
And then, yeah, it's just coming up a lot with like the patients and families. And so I've
Yeah.
learned to just lean into it and appreciate it. And then
Mhm.
it's really informed my own life.
Yeah. Years ago, it's probably been 10 years or more now, I remember seeing something, and I think it was in JAMA, Journal of American Medical Association for our listeners, but it talked about how patients want their physicians to initiate conversations about God, spirituality, faith, etc. But I distinctly remember getting, we're going to call them vibes, during medical school and even in residency, where it wasn't that we couldn't call a chaplain, but it didn't even come up to consider. It just was kind of left off the list. And that bothered me because I knew there was a disconnect with the data set and what we were practicing. And I still see that to this day. To your point, like I don't hear it talked about at medical conferences. We start to hear it more at like the functional medicine or maybe the lifestyle medicine groups, but it's not prolific in the specialties I would think of, like cardiology and oncology. And so that disconnect surprises me a bit. If you think about what you've learned, switching a little bit more toward just general beliefs and perspectives people have, I'm curious because you do some longevity work. You're not just hospice. And there's a bit of, in my mind, a tension between longevity and promoting wellness versus helping someone die well. Can you connect those for us?
Yeah, so I think the thing that was most difficult for me in doing the hospice work is that how death denying like most of the patients are.
Mm,
Like even patients who are on hospice, like most of them like don't believe they should be on hospice or think it's just temporary or and they very much like have the agenda and plan and will to live.
mhm,
And so I was providing like a lot of primary care, but for patients who are like super sick and it felt very futile.
mm.
But there was a large resistance to because I think we just live like in a very death denying culture and like the healthcare
Yes.
system is very so I think it's the healthcare system is that way, but also patients and families are that way. And so a lot of it is just not having these like really intense and honest conversations, but instead just manifesting and sort of treating ongoing acute medical issues. But I think it made me realize, like, people really wanna live, like, people love their lives, like, they love their families, they want more time, and but people are also living with a lot of morbidity and illness and lack of good function, and so I really wanna help people live like, I really like the term health spans, like, number of good quality years, like, someone can have, and I feel like that needs to move, like, further upstream, like, all the way up until, like, people's I'm not a pediatrician, so I can't say, like, pediatric years, but at least, like,
Young
in their
adults.
yeah, like, 20 even like, even the things we do in our 20s and
Right,
30s, like, really
right.
sets the framework and groundwork for how we're
Mhm,
going to age and, like, how we're going to live.
mhm.
And so that's what I mean by longevity. Like, it's really about having people live well and making
Yeah.
good choices about how they're eating and how they're sleeping and what their community is and how they're exercising um and I do think, like, some personalized testing can really help with that and guide that and dictate that,
Mhm.
but I hope my, like, theory or hope is that I think if people do that, then when they do get a terminal illness, like, they actually
Mhm.
are more accepting because they feel like I've really taken good care of myself and I've done everything that's within my control.
Right.
Whereas I think in, like, present day state, a lot of people have a lot of regret
Mhm.
and anxiety and concern, like, "Well, couldn't I could have done something differently," and that's
Right.
actually, like, probably true.
Yeah, I would agree with that completely. And so many people that I talk to, and most of my patients are more women in their 30s, 40s, and 50s, so a little bit younger than the general internal medicine group anyway. But a lot of what they talk about is the idea of I don't care if I live to be 85 or 105. I care that however many years I live are high quality years, which is what you're talking about with health span. I think that most of what I've heard people talk about in terms of aging is I don't want to be my mom or dad. I don't want to have the suffering I saw them happening. And to your point, the healthcare system is going to allow that to happen. We often do things that we don't necessarily maybe shouldn't do just because we can do them. Is that something that you run into quite a bit at this season, or has it shifted with your work?
I think I think it's, like, so complicated. Like, yeah, I think a lot of medical things are happening that don't make sense, and I think part of it actually is distrust. Like, I really think it's, like, both I think in the beginning of my training, like, I really thought it was, like, all doctors' fault or, like, all the
Hmm.
healthcare system fault or, like, the
Hmm.
way insurance is set up. Like, I was very negative and critical of, like, the health system part of things, but I think now sort of so intimately interacting with patients and families, I see that a lot of it comes from them too.
Hmm.
Whether it be, like, a deep, deep, deep love of their loved one and just wanting, like, more time, or a deep, deep, deep fear and
Hmm.
discomfort around talking about and acknowledging death and dying. And I
Mhm.
think also a lot of distrust. Like a lot of people feel like actually the healthcare system isn't doing enough for me or that they don't care enough about me. And I think it goes back to, like, the loss of the community or family doctor, and that we've
Mhm.
now, like, fragmented so much of healthcare where it's like, you have your specialist, and then you have your hospitalist, and then you have your PCP that's, like, impossible to get in touch with,
Right.
and there's no sense of, like, this person cares about me, and they know me, and they get my family and my personality and my values, and they're gonna be accessible and
Right.
advocate for me, and I feel like all of that actually really matters in terms of how people are going to understand and interpret and digest and trust medical information.
Mhm. And it doesn't help that sometimes within kind of conversations we have with each other, we may talk about how much Google or Dr. Chat GPT or all these impair things, but at a fundamental level, we do the same thing in different industries, right? If our car or attorney or engineer, anybody is saying something, we're going to check them. And that is the world we've come to live in. But I don't think medical education got us to understand that. And so we have generations on generations of thinkers and highly intelligent people who aren't connecting on that trust issue. And I will admit, even wearing my physician hat and my wife hat, my husband's had cancer twice. And I went absolutely berserk on the team the second time when they wouldn't look for the problem. So,
Mm.
I am part of the problem and I understand it from both ways. But you're right. Like, you can't, when you feel like you need to advocate and be heard and you don't feel like anyone's listening, that's really hard to trust someone who's got literally your life or your health that they can impact. So then I guess that like makes me wonder, from your perspective, we think about these different beliefs around death and living and dying well and living well. What would be one belief that you refuse to compromise on? Maybe building from what you were talking about with the primary care centralized focus, but is that it, or is there something more that we're missing that we shouldn't be compromising on?
As a physician,
Yeah.
I think just time with people. Like
Okay.
I think you need to spend time with people.
Hmm.
It takes like time to get to hear someone's story and their
Yeah.
narrative and their experience and like get all the information that you need. And that's why this is the most freeing part about going into the direct primary care model where you're not accepting any insurance or you're just like billing people a membership fee
Hmm.
is like you finally can breathe and you can have the time in your schedule and day to be able to really spend sometimes hours with patients, like especially at their initial visit. And I think that's needed to get to know people's histories and their stories and their personalities and connect with them. And then I think what's ironic about all of it is like it makes it more efficient in the long term.
Right.
Like you actually have like much more efficient interactions
Yes.
because you've invested
You
the
know
time
them.
up front and you know
Hmm.
them. And so it's like this
Yes.
whole ironic thing about all of it where it's like we're just not being able to be flexible with our time allocation.
Hmm.
But that's what I always learned. It's like if you actually form the connection and you spend the time, then the things that you're saying, you know how to actually say them to somebody in a way that they will understand and register and internalize, and then they trust you. And so all of your interactions therefore on are super efficient and
Hmm.
impactful.
Yeah. And I think that's a wise way to approach it is invest the time up front, play the long game.
Mhm.
And that's not what we're taught to do. You went to med school at Harvard and residency, or where did
I
you
went
do
to
your
med school at
residency?
Jefferson in Philadelphia.
Jefferson. Okay. Yeah. The reason I was asking, I did my residency training at Cornell in Upper East Side of Manhattan, and I never really saw the time spent that we need to be doing when we have panels of hundreds or thousands of patients in the traditional model. But as a resident, we had half-hour visits, maybe 40 minutes for a new patient. I don't remember. It was longer. And then suddenly you're thrown into this real life world where you see people in 15 or 20-minute intervals. Um, I've come to believe that's a safety issue. I too left traditional system and I don't do DPC, I do concierge's care here in St. Louis. But one of the things that's similar to both models is the time, the
Yeah.
acknowledgement that we can have a conversation.
It's so the first piece I ever wrote like for publication was when I was in med school and a resident told me that I was spending too much time with patients. Like that was the
Mm,
title. It's like too much time with patients. And it was like
Mhm.
sort of reflecting on how, as a med student, I would spend like a lot of time trying to connect with patients and get their histories.
Yes.
And I was really like effective as a med student because I formed these like deep bonds with like patients and I
Right.
could really understand what was going on with them. But yeah, as a resident, like that was their feedback for me. They called me out on it because they're like, you're not spending enough time with like the team or like doing the scut work or like doing the
Mhm.
administrative stuff. And
Right.
every single time we try to find you, you're just like in a patient's room. And I just thought that was so
God forbid.
crazy.
It wasn't in residency, I was early in my attending years, and my boss actually called me aside and he said, "You find these amazing diagnoses and you change people's lives, but I need you to change how you're doing it because you are finding problems only because you're looking for problems."
Hmm.
And I was like, "What am I supposed to be doing?" Right? Like, this is my job, is to find the problem. So, similar analogy of how our training was warped from what we want as patients and what our patients want in their experience.
Yeah. I had to find out all about like functional medicine, lifestyle medicine on my own.
Same.
Like it,
Mhm.
yeah, it's like nothing talked about in the traditional healthcare system. And then I think I just heard enough of these stories where like patients or people I knew personally were just like,
Mhm.
I had this like thing going on. Nobody listened to me. Everybody just dismissed me. My
Mhm.
like traditional blood work was like normal.
Yes.
And then I like was persistent and listened to my body and I believe
Yeah.
that there's something wrong. And then I finally found a doctor who like spent the time and had the additional
Mhm.
expertise. And so I feel like when you listen, you just have to like listen to that and have the curiosity.
Right.
And so I also feel like just giving the time and also being a curious person, like I learned so much from patients in my environments about how to do things better and differently for people.
Mhm. And what's interesting, I agree with everything you just said at a very deep level. And I also hold tension with this constant sense that I'm practicing outside evidence-based medicine, which in residency and even in med school was an idea of if you didn't do things exactly by these guidelines and protocols and studies, somehow that made you a quack. And I think we've swung too far a bit on that, but I'm curious, what do you think?
Yeah, I'm trying to make sense of it too, honestly, because I want to be a very like scientific and
Mhm.
rational person
Yes,
and I also don't want people to spend money unnecessarily. Like I'm
same.
really cost conscious about stuff like in my own life, but also I just take on like the professional burden like
Mhm.
around like I want people to feel like they're getting good value out of their money that they spend.
Right.
And so I think I'm constantly just trying to figure out like what is yeah, like what is helpful to people and like
Mhm.
can be life-changing sometimes and like there just isn't enough evidence because of the way that like funding and research works or the timeline of like how long it takes us to study something versus when something comes out, which are all
Mhm.
like reasonable explanations versus like no, this is just like really good advertising and
Right.
marketing and it's actually not good for the person and
Right.
a total waste of money.
And I think I run into that quite frequently actually with a lot of my women because many of them are juggling multiple different balls and trying to let none of them crash. They're often not only working their full time job outside the home, they're coming home and working a second full time job that they're not paid for. And they're exhausted and their bodies don't do what they used to do. So they do turn to functional medicine or some of these others and I've had so many women tell me about gaslighting and from doctors, right? Nobody's stopping to listen. As you've created this practice environment for yourself, the DPC model, maybe tell our listeners a little bit more about that and why it's helpful to get insurance out. Because many patients will turn around and say, I spent all this money for my insurance policy. I want to use it, right? So help us explore that a little bit.
Yeah, I can totally empathize with that. Like, I would think that too, right? It's like
Hmm.
healthcare costs so much money, so why do I need
Right.
to be spending more money?
Yes.
Or like, why are not any of these tests like covered by insurance? Like,
Right.
I pay for insurance. Like, this makes
Hmm.
no sense. And so, I think I explained it that like the traditional healthcare system just doesn't value preventative medicine,
Hmm.
or personalized medicine, or like root cause medicine, and once you remove like the administrative part of it, like physicians just have so much more flexibility. So for me, again, I don't bill insurance like for my time or my membership. Like I can use it for labs and imaging, although
Hmm.
like sometimes I recommend like things outside of that because it's not covered by insurance. Um, and so once you do that, like people, you can have a smaller panel of patients as a physician And it also just feels like more human of an interaction. Like when people call my office, I don't have to verify like their name and date of birth and insurance information and address and has anything changed. And like it's
Takes
like
it all away.
it's like a frustrating way to start a phone call.
Mhm.
Instead, it's like very human and personable and easy access. And so just the whole like experience and then the time part of it. I feel like it's worth it because I feel like people are actually getting care that will inspire and motivate actual real lifestyle changes.
Mhm.
And I think back to the question around like, how do you navigate between what's evidence based versus what's not? Like, I think
Mhm.
first, I really do try to optimize all the lifestyle stuff. And like, that's typically not optimized for the vast
Right.
majority of people, even
Right.
people who feel that they are that way. Like, I have so many patients who are
Correct.
like, I'm a healthy person. Like,
Mhm.
I eat well, like, I exercise. But then, like, when you actually get into the details of like, what are you eating every single and then they're like, "Oh, I eat
Yes.
dessert like 4 times a week. I drink alcohol, like a few
Right.
times." So you're like, "This stuff matter, right? Like this
Mhm.
stuff actually matters." And so I think or like, I sleep, 5.5 hours a day, but that's
Mhm.
enough for me. Yeah,
Yeah.
so I think
Yeah.
like a lot of it actually really is the lifestyle stuff. And then like the other stuff of it is around like the 10% around like all the supplements and the protocols and
Mhm.
the specialty testing, and I feel like that's afterwards.
Yeah.
Does that resonate with you or
Totally. I'm laughing to myself a little bit because I'm trying to remember which of my kids said it. I have 6.5-year-old twins, and be clear, they're 6.5, right? So, one of them said recently to me something about, he could have dessert because he hadn't had any other sugar the rest of the day. And I was like, "Well, I'm glad you're thinking about your sugar buddy, but no, you can't have dessert." So
Yeah,
"The last time I had dessert was yesterday. I can have it again today." I was like, "Isn't
yeah.
that how we all want to
My
be,
four-year-old said
right?"
to me, she's like, "My brain tells me I need dessert."
Yes, yes. Fascinating conversations.
Yeah.
But that's why I was chuckling. I was flashing back to that and trying to remember what he said about it. But
Yeah.
I
I will
think
say, like, as a mom of, like, many, many kids, I really do
yes.
struggle with nutrition for my kids. Like,
Yes.
I'm very good at it for myself. I impose it on my husband, but it's a real struggle, like, with little kids, and it's probably the thing I have the most mom guilt about, I would
Mhm.
say,
Okay.
because, like, I know how important it is, like, in the long term,
Mhm.
and it's so crazy, like, how addictive, like, processed food is.
Right.
Like, like, they have it once and then all of a sudden, like, just
I want
like
this forever.
yeah, yeah, and, like, anything in a package is, like,
Mhm.
so like, even
Yep.
an 18-month-old baby will, like, gravitate to packages and, like, wanna eat
Right.
what's inside of it, but
Mhm.
it's a huge, like just the financial piece of it, the logistical piece of it, the prep piece of it, the,
Yes.
like, dealing with the pickiness part of it, like,
Mhm.
it's too much of a hurdle for me to get over, so
Yeah.
that's the part that's really tough.
Well, I'll join the club of can't do it perfect every day. How's that?
Yeah, yeah. Someone
Um,
I actually just got a text message yesterday because, we have, like, friends who knew us when we had 3 kids and they had 1 kid, and at the time, they were horrified when we said, like, our kids had bagels for breakfast, pizza for lunch, and then pizza bagels for dinner. And so years later, I just got a text message last night that was like, "We have 3 kids now, and we realized that our kids ate that and then dough balls for dessert, and we're so sorry for how judgmental we were at the time because it's just life is different with more kids."
I love that. I love it so much on different levels. And, it's funny, we can sit here and judge each other all day, just like on the breastfeeding thing you brought up earlier, right? Um, but that doesn't help us move forward collectively. And so many of the people who are doing the judging either aren't in the circumstance or don't understand the magnitude of what it takes to do that with a full time job, particularly one that's literally life stake decisions are being made. So yeah, when you create that club, let me know so I can join it. 'Cause
Yeah, yeah. I mean, I just tell myself, like, I'm role modeling,
yes.
and then I can provide education and role
Mhm.
modeling, and then I think with time, like, they'll learn, like, I think people again, like, if they're given the right tools and information and knowledge, they come to the
Mhm.
conclusion, like, if I
Yeah.
wanna do better and I wanna take care of myself, but I
Yes.
find it really hard to solo individual battle, like,
Mhm.
all the addictive stuff and food, and then just,
Right.
like, how kids are generally just very picky.
Mhm. Yeah, I definitely have not got it figured out either, and there is a certain amount that has to even be individualized within the family for each kid, and there's a certain amount that's standardized, and this is just what the family's doing, but it's tough to figure out
Yeah.
that tension. You said your oldest was how old?
8.5.
Oh my gosh. So the baby's little then, right?
Yeah. Well,
Yeah.
she's the 16-month-old who
Okay.
loves the processed food. Yeah.
Yeah. Yeah. My oldest is 13, and then we took on a foster baby last summer.
Oh,
So
wow.
that's how we got to our five. But they range from 7 months to 13, and they all have very different opinions on what is good to eat. So,
Yeah. I mean, sometimes I try to go above and beyond, and I start making, like, individual meals for each
oh,
child,
that's amazing. I
and
can't do that.
my husband's like, "What are you doing right now? Like, stop it. Like, stop doing that because it's just not sustainable." And then it, like, like, it's also, like, you wanna just create, like, routines and
Yeah.
normalcy and not feel
Yeah.
like they can request, like, the individual things that
Right.
they wanna eat, so
Right. Yeah, I have one child who just he'll just not eat if I try to get him to do exactly what everyone else is doing. And it's so tough because I don't want him to like not grow. But I've had so many people give me advice for different physicians, right? From all specialties. You got to do this, you got to do that. And it's just too much. And that kind of goes back to what we were talking about, right? Like there's so much information, and how do you trust the person sitting in front of you if they can't even make eye contact and they can't tell you the why behind what they're recommending. I run into this a lot with women around cholesterol and the statins and
Mm.
whether or not they want to start one. Or I have so many people come in on their first visit and they're like, I'll just tell you right now, I'm not going to take a statin. I was like, I didn't even ask you to, right? Like, calm down. Let's bring it real. Why do you feel that way? And um, I love having longer conversations with people and being able to optimize that. I'm curious your thoughts because you and I are on somewhat parallel paths in terms of how we've chosen to practice. We hear and have been hearing for years about the upcoming physician shortage, about how there's going to be so many older adults after 2035 or so, and how there's not enough nurses, physicians, etc. Sometimes people ask me, well, how can you, in good conscience, do what you do instead of seeing the 3,000 patients that you had in your panel before you did this? And I tend to talk about the time and how I wasn't going to be able to stay doing. How can you even know 3,000 patients, first of all? But I'm curious, do you get any pushback like that, or what are your thoughts on the topic?
I think, like, I'm a super hardworking person. Like, I have always been like incredibly studious and incredibly hardworking. And I was like on the verge of burnout. Like,
Yeah.
I just was like, this doesn't feel good. Like, I'm not
Mhm.
I'm not connecting. I'm not enjoying. I felt like I was like just in an aloof like state, if that
Yeah.
makes sense. Like,
Mhm.
just completely, yeah, there was like a level of like disconnect. I had
Right.
completely stopped writing even
Mm.
like, for a period of a few years, and, like, before I used to write so much because I, like, wanted things to be better, or, like, I couldn't stop thinking about a patient or a certain
Mhm.
clinical situation, and I wanted to reflect on it and share it with, like, as many people, but I couldn't even do that. Like, I wasn't even, like, in touch with my emotions or what was happening professionally. I was just, like,
Yeah.
walking around in a cloud and, like,
Mhm.
doing the motions of the work, but not
Mhm.
enjoying it or feeling connected to it. So, for me, this feels like the only sustainable model for physicians. Like, I'm
Mhm.
so happy now
Yeah.
professionally. I'm like, this is amazing. Like, I love showing up for work every day. I love like the patients I take care of. I feel like I'm taking good care of them. Like, they feel
Mhm.
that way. And so I guess I don't feel bad because it just feels like
Yeah.
the only sustainable option.
Right. I can
Like,
do this for a
yeah,
long
like
time.
all those other people are like part of the shortage is like the issue of burning
Right.
out. And I
Right.
didn't want to give up on medicine because
Mhm.
I care so much about, like, I think medical care matters and like we
Yeah.
need doctors. And I went through all of this training and I think about all the people who like didn't get into medical school who wanted to
Mhm.
be doctors. So I feel a responsibility and commitment to the profession, but it also
Mhm.
felt so unsustainable.
Yeah.
So,
Yeah. I mean, for me, it came down to my daughter asked me one night, she was 7 at the time this happened, but I had just shy of 3,000 patients and was working 70 something hours a week with 4 kids at that time. And she says, "Why do you love your job more than me?" And that was never, ever the intent that I would want to broadcast, right? Like, I wanted to be a good doctor, but more so I wanted to be a good mom. And that was a big catalyst for me making this change. But, I think back, how many times did I miss a subtle sign or a conversation I should have explored or things that would have naturally expanded had I not been in a 12-minute time crunch to get to the next room. And it makes me kind of angry, not kind of, really angry that we have so many intelligent people who want to heal, who are trying to heal and help and serve, and in many ways are abused, both men and women. I do think that women experience it differently than men from external observation. But I think there's also maybe some advice that women physicians tell younger women physicians that's actually harmful. Um, things I have been told, for example, you can't have it all, or you can have it all, just not at the same time. And I struggle that this is not good mentorship, and it's leading women to do the same thing people in front of them did rather than stop and look around and say, what is there a different way perhaps that I should go down?
Yeah, for me, when I was in med school, like I saw these attendings who were like in their probably very, very late 30s, like early 40s, and they were having really, really tough pregnancies
Mhm.
or really, really sick babies. Like a lot of people
Yes.
had their babies like in the NICU, but then they were
Right.
still working, but
Mhm.
like they had twins in the NICU and
Yep.
it just really stressed. I was like, this is so stressful. Like I feel so
Yeah.
stressed like on
Yeah.
their behalf
Yes.
that they're and then so then my husband and I like reasoned from first principles and we're like, we should just start having children as soon as possible.
Yeah.
Because I think it'll probably be, like, yes, like residency is hard, but
Mhm.
um it just seems like there's no better time than the present to try
Right.
to start a family. And I'm so grateful for that I did
Mhm.
that because now I have, 5 kids and I'm like 34. So I feel like I could do so much like professionally, but I have a lot of
Yep.
flexibility and I don't have to stress or be anxious about trying
Mhm.
to have a family. And so I feel like it was not mentor. It was like I didn't have mentorship, but
Yes.
it was just seeing like what was
Mhm.
happening before my eyes and being like, I
Yes.
don't want that for
Right.
myself.
Yes. So do you think, maybe we're kind of on the realm of women physicians, so I'm thinking there, but I'm also laterally thinking just women professionals of all different industries. What do you think women in this season, where they're trying to climb the career ladder, but it's also the same time that they're biologically able to reproduce? What do you think the disconnect or what they misunderstand about their bodies is?
Yeah, it's so sad. So I live in DC now, and the median age or something at one of the hospitals here for like your first child is like 37 or 38 years old. And so
Wow.
it's a very highly professional environment, and a lot
Mhm.
of people that I interact with are not starting their families until their late 30s.
Mm.
And so I think part of it is culture, just the culture, right? Like a
Mhm.
deeply embedded culture. And then a lot of people will say, because I talk about this a lot of people, and they'll say, like, nobody told me otherwise, right? Like,
Right.
nobody told me, like, the best time, like, really the best time, like, physically to have children is like in your 20s.
Right.
Um, or like, and really like nailed that point home.
Mhm.
And so I think it's a kind of like only after people go through the experience do they then realize like, and even for me, even each year, it just gets like so much harder to deal with like the sleep deprivation and the
Yes.
lifting and
Yes.
like it's not the same as when I was like 25 years old.
Right.
But I can't even imagine like starting this like when you're 37 or 38. And obviously like it's better than the alternative, which is not starting to have a family
If they
at
want one,
all.
yeah.
Yeah, if they want one. But I think a lot of people do, right? Like a lot of
Mhm.
people do want one. It's just like
Right.
the cultural conversation or the cultural narrative, or like we don't want to make people
Yeah.
feel bad, right? That's
Yeah.
also probably part of it. Um, but I don't know. It's something I try to talk to my kids about a lot.
Yeah.
Um,
It's a really good point. I mean, I definitely think back to when my oldest was a baby and now the baby we have who's 7 months old. I'm like, "Oh my gosh, this is why God has young women have babies," right? Like, it
yeah.
is hard, and sleep deprivation does stack up, and then by the time you're in your 40s, generally some of the changes of upcoming menopause may be hitting in.
Yeah, I
It
mean, I do blood work now on like postpartum women
Yeah.
and it's not good. Like,
Mhm.
you know what I mean? It's like
Right.
the inflammatory markers are up, like
Mhm.
hemoglobin A1C is up, like it's not and then you're like, "Oh my gosh, this stuff is like affecting you
Right.
metabolically."
Right. Right. Do you think that, I'm wondering, when you think about what is harmful advice versus just misunderstanding, do you think part of that is coming from the medical profession? And the reason I ask is in terms of delaying family, I got the sense a lot through school And I'm biased because I was in the medical profession for school, right? But it was almost a sense of you can't be a good mom if you're trying to be a resident or if you're in medical school. And I had peers that did it, and it sounds like you might have done it. But do you think that that is actually something we need to change in our dialogue, not just across our culture, but specifically starting in the medical community
Yeah, I
and in
think
other
it's worse in
professionals?
the medical professional
Hmm.
profession for sure. Like I think there's so many studies that show that rates of miscarriage and pregnancy loss
Right.
or infertility
Hmm.
starting older is like
Hmm.
very prevalent in the medical field. And it's really sad. Like, I mean, some of it goes down to like our training policies and
Hmm.
just the idea that we're like constantly short staffed, right? Like that it's
Right.
like if you take maternity leave, like you are
You're
really
dumping on someone
yeah,
else.
like you're making a very, very hard residency experience for other
Hmm.
people. And then
Hmm.
the people in blood medicine are just in general very altruistic and like high
Yeah.
empathy people. And so I
Right.
think that combination
Hmm.
just makes it really hard, right? It's like you don't want to burden other people and you want to be hardworking and you care a lot about what other people think about you.
Yes.
So I just had to like, I was just lucky. Like I was really fortunate that like I had basically everyone in my family is not in medicine, so they were like, "This makes they're like, "This makes no
Right.
sense." Like,
Yes.
if like, people have to cover for you, right? If you take off
Right.
maternity leave, like, that's a thing that and it's up to the program to come up with a
Right.
solution, it's not up to you.
Yeah. It's not your problem.
Yeah.
That is definitely not a phrase I think I ever heard in medical school or residency. It's not your
Yeah.
problem.
Yeah. Oh,
Um,
I mean, I had a miscarriage, like, during
mm,
med school. That my first pregnancy ended, like, in a late 2nd trimester miscarriage,
wow.
and the dean of the school, like I asked if I could, like, have a few days off from
Hmm.
one of the clerkship rotations, and she said I would fail, like, the rotation,
My
if I didn't
gosh.
come back, like, right away.
Wow. And that's not an
Like, the
early
options were, like
miscarriage.
my options were, like, fail or,
Yeah.
like, take the year off and then
Wow.
come back. Yeah.
How inflexible. I'm so
Yeah.
sorry.
Yeah, so it's just, like, that kind of environment
Mentality.
and, like,
Yeah.
culture and mentality, like so it is institutional, and then it's, like, from the individuals, and that
Hmm.
so it's like a trickle down effect, it's really sad.
It is, and it's controlled by things above us. And, I don't know, I can't speak to other professions, but certainly for our listeners to understand, if you don't finish residency, it's very unlikely you'll have a job. There are outliers and people who've done it, but residency is a really big deal. It's not just enough to go to medical school in the United States.
Yeah, and I just had to be flexible, so I ended residency, like, a few months late, and then I worked
Mhm.
as a hospitalist for, like,
Yeah,
10 months until I could go to fellowship, and so
and you made it work for you.
yeah, 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 but you just have to kind of accept, and then you kinda accept, like, you can't that so many things are beyond your control, like, I
Mhm.
think all of motherhood and pregnancy and the fertility journey has taught me that, like,
Yes,
like, there's been so many miscarriages along the way that it's like
right.
I kinda just accept, like, when I get pregnant, and, like, when that baby is born, like, that'll be that's how it will work, and I
Mhm.
will make it work, but I
Yeah.
don't try to, like, control things anymore.
Well, there's so little we can't control. We think we can control it.
Yeah,
And as doctors, we're taught to present that, right? Like
yeah.
this is what the studies show,
Yeah.
but
So
there's so
people are like, "Okay,
little.
I'm gonna time my pregnancy so it
Mhm.
happens, like, during
Yeah.
my
Uh-huh.
electives of, like, 3rd-year residency." I'm just like,
Mhm.
"Uh-huh." Like,
Cool.
yeah.
It's kind of like
Yeah.
our colleagues who talk about the women who want the natural birth, and they come in with the birth plan, and then nothing goes according to plan, right?
Yeah, yeah.
And so, I have a a lot of empathy for that too. There's so many different, ways we could go, and as we wrap up, I'm just curious, what have we not talked about that would be helpful that you wanna get out to our listeners?
Um, I think, like, yeah, just really realizing that life is, like, amazing and every day, like, really matters. Like,
Mhm.
I feel like, I'm just so grateful for my professional choice of working in hospice care because it's informed, like, every meaningful personal decision I've made in the last, like, few
Yeah.
years, and I have this, like, whole theory that because, like, we don't experience, like, death as a culture anymore as much,
Mhm.
like, most people will just, like, experience a handful of deaths in their lifetime,
Right.
and it'll happen a lot later in life, and so
Mhm.
that's, like, an amazing testament to modern medicine
That's true.
and
That's true.
sanitation and, like, vaccine all this
All
amazing
the
stuff,
things.
right? So, like, that's wonderful, but this weird downside effect that's happened is that we don't, like, question what is the meaning and purpose of life?
Mhm.
And how do I make life most meaningful? And like, what are the
Mhm.
relationships that matter to me? Like, just sort of all these like existential questions, like, don't come up as much for people because, like, when people do experience a death, like, they do oftentimes go through like a profound personal and like professional
Yeah.
transformation. And so for me, it's been such a like a blessing in a way to get
Mhm.
that like every single day. And I feel like I get a reset. Like
Yeah.
it's helped like my marriage. Like, cause like we definitely get into like arguments, like,
Right.
but I'm like the next day I'm like, oh my God, like I'm so sorry. Like like we had our time together is so short and like I
Yeah.
just want to be like happy and in love. So I think just trying to seek out as many opportunities, honestly, where you
Mhm.
can have that level of connection with people.
Mhm.
If it's like volunteering in a hospice or going to funerals, like even if it's someone you don't know that well, or
Right.
just reading about this or talking to people about it, like just
Mhm.
kind of having these daily resets where you realize like
Mhm.
the small moments are the big moments.
Right.
And I think that will motivate people to take better care of themselves too.
Absolutely. It at least brings it into perspective so that they can make an active choice. Um,
Yeah.
and that's not something that most of us do until it's forced on us. Um, really beautiful places that we've been able to visit today. Thank you so
Yeah.
much
Thanks for being
for.
so cool for talking about death.
Hey,
Yeah.
it's interesting to me in so many levels. I'm a Christian, and so I am very much open to the idea that there is something after life, right? But what was fascinating to me is we didn't talk about it in med school. I did my internship at UT Southwestern in Dallas, and at that time, the director of the palliative care program was just one of the national leaders, and she was so
Mhm.
articulate, and she just really showed all of us the data of how much having these conversations makes a difference in long-term outcomes, and it kinda just drilled it into me. So, when I saw that you did that, but then you had the longevity piece, I was like, "This is really cool." So, I'm so glad that you were able to be here today and
Yeah. Thank you so much.
absolutely, and talk about it. So, for our listeners, if something in today's conversation resonated, it's because you're not alone and you're not imagining it. You can find more support and resources, next steps in the show notes. If this episode helped you feel seen and helped you realize what your next best step is, share it with some other woman who also needs to hear it because together we're going to make this better. Thanks, Dr. Grinberg, for being here today. And until next time, we'll see you soon.
Of
Bye.
course. Anytime. Thank you.